No, let's do the meter dose inhaler. What is this? What is this?
That's the spacer. No?
That's the metered,
It's the what?
the metered part.
The metered part, okay? You will see umpteen different kinds of medication for asthma or breathing or COPD, Ventolin, albuterol, Nasacort, Preventol. You'll see tons of different kinds. Do we have to know the names for all of them? I hope not to, because they come out with new ones every day, okay? They have started, and I don't know if you'll know this, they have started putting the names on the cans. I wish they do it on everything. They have started putting the names on the cans for that particular patient. The rules for these medications that we're showing you this morning, or this afternoon, all apply, the same three things. They have to have the criteria or the indication for that medication. You have to have a confirmed doctor's order, and it has to be theirs, okay? You can't give Brandy my inhaler, okay, even if she's having problems breathing. There's other treatments we can do, okay? So let's go through the same thing. Avoids contamination of equipment. BSI is mycene safe. When you're grading, when you're testing, it's just like the other things. You are testing this. You're not testing patient assessment. We've already done patient assessment. We know that he needs this. This is the intervention that you're doing, okay? So, but you still need to tell us BSI, okay? Confirms orders. I've called in to Shannon. My patient is having trouble breathing. He has a history of asthma. He has his inhaler here with albuterol. Can I administer 2 puffs of his medication?
And on your sheets, when you're being evaluated, the examiner will state, the patient meets all criteria for administration of a bronchodilator. Medical control has authorized the administration of albuterol via handheld metered dose inhaler. And they will say also albuterol, 1 puff or 2 puffs.
And did I understand you to say that I can administer 1 puff or 2 puffs of the albuterol that is the patient's?
Yes, 1 puff.
Okay. Again, confirm that. You did say that I can do 1 puff through this patient's inhaler, okay? Travis, the doctor has said that he wants me to help you do 1 puff of your inhaler, okay?
Okay.
Selects correct medication. Again, I'm going to look at that. This doesn't say it, but, it says Preventol, but albuterol. The doctor has said that he can have 1 puff of that albuterol, okay? Checks medication at expiration date. They have an expiration date on the side right here. Make sure that it's still in date, okay? Because they could have had it 10 years.
Would 1 puff be able to relieve the symptoms of asthma?
It might, it just depends on how long. If they're just now starting their attack, chances are it probably wouldn't, because it took us 4 or 5 minutes to get here, and he's already, they're probably not going to call when it first starts. But it might, you never know. Start out with 1. Whatever the doctor orders, the doctor may tell you 1 puff. Try 1 puff and see if it works. And he may tell you try 2 puffs. Okay. We've checked to make sure that our dates and these kind of snap in. You can't just set it in there and it's going to work. You kind of have to snap it in place. Some of the new ones, mine has dosages, how many's left on here. You can shake it and feel it in there, but some of them, the new ones have the dosages, whether you've got 30 doses left or 10 or whatever. And we don't have a spacer, but the kids, do you have that spacer?
I don't know, go ahead now.
Okay, we'll show you a spacer for the kids, but And this says apply spacer if ordered. For the testing purposes, it won't be ordered, correct? We're not gonna,
Well, if the patient, in real world, if the patient has a spacer, you want them to use the spacer.
yes.
Because some of these can be really, really costly. Okay, and what does a spacer do?
Doesn't it hold the medication for like a certain amount of time?
All it does really is it dilutes the dose with air and allows them to breathe it in over a few breaths instead of getting the full medication in one breath.
You'll see a lot of kids with spacers.
Yeah.
A
And
lot.
some adults, depending on the inhaler.
That's right.
My wife has one where she does have a spacer. And if she takes it just straight, she coughs it up, doesn't do anything. She uses the spacer, she's able to breathe it a little bit over a couple more breaths. You know, it's like diluting it.
Okay, this is a spacer, this is a kid's spacer. Same nose piece. You can see how you would squirt that in there and it wouldn't be, it would take them several breaths to get it in good, okay? Let's turn the spacer up. Okay, we've checked again, made sure. Now, since we've already done our assessment, our patient is on a non-rebreather. So we're gonna take our mask off. Verbalize it, check that medication, because if you've set it down and he's got 4 or 5 inhalers to take his mask off, picked it up, and here we go again. Okay, so pick it up, make sure you, and it doesn't take long. I mean, just make sure you got, okay, yep, that's a Buterol. Instructs the patient to take a deep breath.
Bless you.
Bless you. Put the mouthpiece, I need you, okay, you can breathe. We're gonna put, I'm trying to make sure we're going by the steps. We're gonna put this in your mouth, make a tight seal around the hole. I'm going to puff, you're going to inhale and hold it as long as you comfortably can. Okay, you don't want them to turn blue, but you want them to hold it as long as they comfortably can because it's got to get down in those lungs and all into the alveoli, all of that. We want to get as deep and as far as we can. So, take it, exhale, take a nice deep breath, puff. Oh, wait a minute. Exhale. Okay, I'm going to puff, I'm going to push, and you're going to take a nice deep breath. Ready? Hold it, hold it, hold it, hold it, hold it. Hold as long as you can. And exhale when you need to. Okay. And then you put your mask back on. Okay, this says instructs the patient to depress the inhaler. Okay? And then hold breath as long as comfortable. And you're going to put your oxygen back on. Okay?